I am Jennifer Bridges, and I am the rehabilitation technician here at the Integrative Medicine and Rehabilitation Services. I've worked at the School of Veterinary Medicine for almost 14 years now. I work in the Integrative Medicine and Rehabilitation Service, and I am the rehabilitation technician. I work with all of the equipment that's here in rehab, as well as the underwater treadmill, and I see about 6 to 8 patients a day just through rehabilitation, along with the acupuncture patients that may come in that need to be seen. The majority of our patients are dogs, but we will see cats, horses. I say if it fits, we'll see them in here. But we see mostly patients that come in through orthopedics and neurology, as well as some from internal medicine. So we'll see surgical patients such as IVDD back dogs. We'll see cruciate disease. We'll see old dogs for geriatric quality of life care. We also will see some neurologic cases that are like brain injuries and that sort of thing. That's mostly what we see here. A typical day, I come in and occasionally I will teach rounds to the students. So that will take some of my morning. And then I start to receive patients at 9 o'clock. And then most of my patients I see for about 45 minutes to an hour each. And they will include any kind of exercises we may do here, as well as therapeutic ultrasound, electric stimulation, laser, and then of course the underwater treadmill. The rehabilitation we do here is similar to what you may go through in human medicine. So we will do a full exam to find out what the needs are. And usually those needs are based on things that are referred for. So if we know that a patient has had knee surgery, we know that's going to be our primary goal is to work on that knee, but eventually we do work on the overall patient. But we have a lot of very similar things here in veterinary medicine for physical therapy that you would see in human medicine, including some of the exercises that we do are based back on what they do for humans, since animal rehabilitation is fairly new. But we do have the exact same ultrasound machine and electric stimulation that my human physical therapist has and my chiropractor has. So we see a lot of very similar cases and work them through in very similar ways. So instead of a two-legged patient, we see four-legged patients. I initially wanted to be a veterinarian. I think most technicians go through, that's what when you want to work with animals, when you're 5 years old, you're going to become a veterinarian. And there's not a lot of push to become a veterinary technician or a veterinary nurse. And as I went through my undergraduate, I decided that maybe going 4 more years, more expensive, was not the way that I wanted to go. And I feel like as a veterinary nurse or technician, I get a lot more hands-on, and I get to do a lot more of the procedures versus just the diagnosing. But I feel like I get the follow through. My educational journey was not the typical vet tech one. Again, I started out wanting to be a veterinarian, so I actually have a bachelor's in animal science, and I have a master's in nutrition and physiology based in actually neonatal ruminants. I took that and applied my physiology background to work on this. I worked in private practice as a vet assistant for about 7 years before applying here for this position. I'd love to say that it was an epiphany and this is what I wanted to do, but I thought it sounded really cool, so who wouldn't want to apply for this job? And once I got it, I jumped full force in. I did go full circle working at private practice and then coming here at the LSU Teaching Hospital. And the biggest difference between working in those two environments is the ability to grow. So in private practice, I really did love working there. I loved the veterinarian that I worked for, but there just wasn't any room to grow. I was going to be there as an assistant, technician, work to help with exams and work and help in surgery, but there was not any growth. Here, I was able to come and not only find my specialty that I absolutely love, but was able to grow, to be able to get my certification, to be able to follow through. And I'm actually the outpatient services supervisor now, so that ability to grow has not just been as being a technician, but also in an administrative role. I have 3 dogs, all rescued to my favorite breed. My oldest is 15 years old and my youngest is 6 months old. And then I have 4 cats and a 3-legged tortoise. My hobbies include traveling with my family, but my biggest one is I am a crazy plant lady. I'm all about plants. I have about 150 potted house plants, as well as vegetable garden and a cut flower garden. I love all plants, any plant. I will never turn them away.